Hello, my name is Jade and I did my project on MRSA, that is methicillin-resistant Staphylococcus aureus. MRSA is a very common bacteria that's found on the skin, even in the nose and other mucous membranes in about 1/3 of people. It can remain on the surface of your skin for days, even up to a period of weeks. And this is also a drug-resistant form of staph, so it does not respond well to several different types of antibiotics. People at risk include children and workers in daycares, same with schools, people who inject drugs, people who live in close quarters with others, like in dorm rooms or barracks in the military, anyone with an open wound, especially if you're in a hospital or nursing home setting, just because there's more of the infections that go around, athletes, just because you're touching skin to skin sometimes, and then anyone that might be in an unhygienic condition. Signs and symptoms would be red and swollen painful skin, pus or drainage from the infected areas, fever because your body's trying to fight off an infection, and usually it starts out looking like a spider bite. So please don't be fooled by that. If you think that you might have MRSA, say something. The infections usually occur on broken skin, so like cuts, open wounds, even surgical wounds, and if those are left untreated, you can get other infections like pneumonia, sepsis, and even die. They test for MRSA by swabbing wherever the pus is or wherever your open wound is, and then they take that to the lab, test that, and confirm or deny what you have. If you suspect it, please go get that taken care of, because a good rule of thumb too is to make sure that you don't pick at or touch any of your sores, because that can also spread bacteria, and then making sure to keep the areas clean, dry, and covered. Treatment does require antibiotics, but like I said in the beginning, it is difficult because it is such a drug-resistant strain. And then surgery can also be used if needed to drain some of the infected areas. So potentially like an incision and drainage, where they kind of cut open the wound, drain out, clean, pack, and then kind of cover and try to keep that clean. But overall, recovery really just depends on the severity of the infection and the timeline in which you seek treatment. So again, make sure that you follow up as soon as possible if you think that you might have MRSA. It's very contagious, and it can spread on many occasions. So like I said earlier, direct contact with infected wounds, touching contaminated areas, gym equipment, medical supplies, sharing things like razors, and then the main thing is to just please wash your hands. Preventing it, wash your hands. Avoid sharing any personal items. Clean and disinfect countertops and other surfaces that are used regularly, like chairs and tables, even your cell phone. Using the proper PPE when handling MRSA is always very important, like masks, eye protection, gloves, gowns, even if necessary, and then also quarantining if you have to. Thank you very much for listening to my talk about MRSA, and this is my reference. I hope you guys have a great night. Thank you.